That's the question that we know the least about. So we know that there are toxins there and we know how they work, or we're making great progress, but why are they there in the first place? In a very limited group of people with Alzheimer's disease, we know the answer, and that's because they have inherited Alzheimer's disease. That's maybe 1% or less of the total amount of Alzheimer's patients. They have mutations. The mutations cause a buildup of a small peptide, and that peptide leads to the formation of plaques and the formation of toxins. How that happens in other people, we don't know. Some interesting clues. So some work indicates a relation with diabetes. And as a matter of fact, there's a correlation between having diabetes and getting Alzheimer's disease. It turns out to be a risk factor that nobody knew. And at the cellular and molecular level, inadequate insulin in the brain promotes the onset of these toxins. And that's a sad thing, but it also points to maybe some way of treating the brain. If we can get insulin signaling in the brain better, and there's a group at Washington, Susan Kraft, who's doing clinical trials with insulin to treat people with Alzheimer's disease, and it shows some promise. Probably not, so far as we know. You know, we've looked at possibilities. Air from polluted cities, we've actually looked to see if they cause a buildup of the toxins, and it doesn't. Cholesterol may be a factor. Turns out what's good for your heart is good for your brain. So you don't want to have high cholesterol because that can promote the type of metabolism that generates these toxins. You know, we're all making the precursor to the toxin. You and I right now are making it in our brains. And people who get Alzheimer's disease can't get rid of it. And that precursor to the toxin builds up, and then it sticks to itself and creates the toxin. The toxin, it's kind of like plaque formation in an artery, where you have high cholesterol, and cholesterol's good, you need it. But if you have too much cholesterol, it builds up in your artery and causes serious problems. It's the same in the brain. This peptide called A-beta, normal. But if you have too much, it builds up in the brain and creates toxins. The environment's certainly different. We're in a more polluted world in some aspects and less polluted in others. Probably the same toxins that affected Augusta D in Alzheimer's clinic are having an effect on our brains today. I don't think there's any evidence to suggest there's a different type of toxin. Matter of fact, it's just this one toxin that starts the toxic ball rolling. It's the culprit.